in some remote areas where people can't get access to basic health care. And then, as I mentioned, a big one is environmental exposure. So some things that we can consider are indoor pollution, such as wood and coal, especially in remote areas that use these materials to warm their homes. And so what are some of the possible solutions that we can think about when addressing these changes in infrastructure? Again, thinking it from a standpoint of a larger scale, that more so than what we can do as a cancer center at whole. So again, it's just supporting policy and legislation to increase funding and to create infrastructure to improve the existing infrastructure in some places. Changes in BIA and tribal government policies to promote land ownership and to help generate developmental funds to improve a lot of the land ownership that we do see. Increase funding for Indian Health Services and 638 services. And lastly, increase EPA funding for Superfund cleanup efforts. And I will provide an example of how environment does play a huge role. So on the Navajo Nation, there is a huge concern for uranium environmental exposure. So the Southwest has a huge deposit of natural occurring uranium. And so uranium has been historically mined in our tribal lands since the early 1940s. And so as you can see here, a lot of people were exposed through occupational working in the mines. As you can see in the pictures on the far left, a lot of the miners that worked in the mine didn't speak English as a first language. They didn't have a Western education, so they didn't understand the hazards of working with uranium and mining of uranium. And then a lot of them didn't have the proper PPE to work in these mines. And so a lot of the miners since have developed lung cancer and bone cancer. And so it is a cause for concern. Additionally, we also have to think about our people who are working in the military. In the early Gulf War conflicts, over 334 tons of uranium were used in those conflicts. And so a lot of our veterans have shrapnel embedded in their bodies. And so there's a lot of long-term research that is happening right now to follow up with our veterans with depleted uranium in their bodies to see what the long-term effects of those are. Because the mining of uranium was a matter of national security at the time. And when the Cold War was over, a lot of the mines were just abandoned. And so it caused contamination of local water sources. And so there was a lot of concern with with the limited source of water and what that might play a role as far as consumption, how we use it for our livestock, how we use it for our agricultural uses. And then also another environmental exposure was the use of depleted uranium mine tailings as construction material. So as I mentioned, a lot of the miners that lived in the area were not educated about the harmful effects of working with uranium. And so they saw it as construction material. And so they made some of their homes out of this construction material, resulting in families being irradiated 25 times higher than the safe exposure limit to radon. And so since then, the EPA has gone in and cleaned up some of these sites. Um, and this map here just shows what it looks like in the Four Corners area, where there's a lot of legacy and abandoned uranium mines on the Navajo Nation. And so the photos around the map just shows what some of the mine tailings look like. A lot of them were at this point were not fenced off, they were not marked. And so you could just see how close families were living in the area of these mines. And so as of now, there's 3 Superfund sites there on the Navajo Nation to clean up some of these areas, but there still is a lot of concern what's happening as far as uranium exposure, and then now with the current transport of uranium through the state. And so another barrier when we come to gaps in cancer care is communication. And so culturally, there's a lot of language and cultural barriers that we must consider. There's different communication patterns. There's inaccurate or lack of data, especially when it comes to data regarding cancer in our tribal communities. There's a lack of cancer knowledge, a lack of patient navigation services, and a lack of cancer survivor support groups. And so what are some of the things that we can do? Expand cultural and language and relevant resources for our communities, creating survivor stories and sharing videos just to highlight the importance of cancer prevention and how cancer can be survived. Creating cancer care plans for our survivors. And a lot of things that we're currently working on is increasing education and training when it comes to screening practices and guidelines, translating data into a culturally appropriate prevention and intervention programs, maintaining and improving cancer surveillance among our tribes, and then expanding our collaborations among our tribal health programs and our senior centers and our IHS clinics. And so some of the things that we're doing here at the Cancer Center is outreach to expand education. So we do have our little series called Let's Talk About Cancer. And yes, as the name implies, we do serve tacos. And so it's a lunch and learn to promote cancer education and awareness. And so we work with a lot of local businesses, especially tacos vendors and food vendors, to work within our lunch and learns. And so we host these throughout Southern Arizona. Usually the topics are picked by the community members and what they want to hear. So we, in the past, have talked about cervical cancer, colorectal cancer, skin, blood, stomach, and breast cancers. And so the main impacts that we do get out of these events are an increase in cancer knowledge. And then we also ask about the likelihood of people getting screened after learning about the event and the likelihood of them recommending it to people. And then we also try to keep demographics of people who are attending our events. And so as we see, we get over 51% of our demographics identify as non-Hispanic white. We do have 20% Native Americans attending and several other demographic backgrounds that attend our events. We do a lot of outreach for our survivors through our Beyond Cancer Survivors conference series. And so the point of these conferences are to share resources with survivors and caregivers. And so this cancer conference series we host across the state of Arizona, so we're not limited to Southern Arizona. We've worked with over 57 community organizations. We've had over 366 people participate in these conferences and connecting over 287 people to support services and resources. And this has been in partnership with the Arizona Department of Health Services, as well as a lot of our tribal health organizations, including the Pascua Yaqui Tribe, the Navajo Nation Breast and Cervical Cancer Prevention Program, our Tohono O'odham Cancer Prevention Program, our Hopi Cancer Support Services, and San Carlos, as well as the Tucson Indian Center. And so even though this conference is geared towards survivors and caregivers, we open it up to everybody. So we get a lot of general attendees. And we also share topics about having our survivors and celebrating our survivors to share their cancer journey. And so they are the biggest advocate in the room to remind people to not ignore your symptoms, to go get screened, and that cancer, you can survive cancer, and it takes a village, but it's to address also the taboo of this topic, especially in our tribal communities. And so we do get a lot of people who find the information informative and very valuable and are likely to participate again. So another thing that we do is working with several different FQHCs as well as organizations across the state to increase education and navigator training, especially in our underserved communities with our cancer patient navigation trainings. And so far we've trained over 40 plus patient navigators and community health workers that serve in tribal communities across the state. And so the people that we have trained, they work in 6 different counties and work with 12 different tribes in northern Arizona. Whereas here in southern Arizona, they serve 2 counties and work with 4 different tribes in southern Arizona. And I would like to highlight one of our partners that we've been working with for the past 5 years now is the Pascua Yaqui Tribe Health Department. And so our goal with this partnership is to build a sustainable partnership to increase cancer education and screening among the Pascua Yaqui tribal members. Some of the activities that we have done in the past is having their medical director serve as our community advisory board chair. We have a 5-year agreement to hire and support a nurse navigator that works and is housed at the tribal department in the health department. And so they do a lot of outreach events. We work to create events to bring mobile screening units to the tribe, including fibroscans and vaccine clinics, working with them to create their support groups. And so some of the impacts, again, is just connecting the connections to care, increasing knowledge and awareness, and also screening activity there in the tribe. And so far, our nurse navigators have engaged over 1,500 tribal members. They've screened 82 women for breast cancer, and we've also navigated 25 patients through cancer care services. And so one of the other things that we are addressing at the gaps is trying to help with their cancer surveillance and having the information to help build their cancer prevention program there in the tribe. And so with this, we're doing a population health assessment with the tribe. Um, a lot of the content areas that are there are listed on the left. Again, having a cancer focus on this population health assessment. And so I have a timeline that I'd like to show what it is to work with tribal communities and especially building a sustainable relationship. And then I like to highlight that this takes time, especially when you're working with the sovereign nation in a nation format. And so what we actually are doing since 2021 is we started having the discussion of what this survey would look like. We started a lot of the consultation and approval process and going through litigation with the tribe and our cancer center and the university. And so as of August 2024, we finally got tribal approval, again, showing how long it takes to work with a sovereign nation. And then again, we had some updates that we had to do on the IRB. We had to work again with the new council that was elected in. And so starting soon, we're going to be launching the survey. We're going to be training the health department there so they can actually launch the survey, collect the data. We're going to be working with their epidemiologists so they can analyze their data. And then we're also going to be providing technical support on how they can disseminate their survey results on how they want to do it. And then also looking into see how we can use this information so they can develop their cancer prevention programming. And so the tribe themselves are leading a lot of these activities. And so for the standpoint of our cancer center, we're being more of a technical support, um, letting them guide this and letting them guide what the survey looks like. And it's just having a true partnership. And so with the data, they own the data. So again, that's why this approval process has taken so long. And so I'm one of the co-PIs on the IRB, and I won't have access to the data, is how much we're respecting tribal sovereignty and working with the data that we're working with the tribe on. Another barrier, moving on, is dietary. And so there are a lot of challenges, especially when it comes to our tribal communities. Most of them are a food desert when you think about it. So again, to use the Navajo Nation as an example, there's only 14 grocery stores when you think about how large the Navajo Nation is. The food insecurity rates is 77% compared to the US that has a national rate of 10%. And another barrier that we have to think about, again, in very rural communities that don't have electricity, is the lack of refrigeration. And so there are some solutions that some of the tribes are doing to address this issue. So they're increasing funding for local agricultural programs, developing sustainable nutritional programming within their communities. And I know they're increasing taxes on junk food, tobacco, and soda just to promote healthier eating. Another barrier that we also face is geography and transportation. And so, for example, in Arizona, especially when you think about what the Navajo Nation looks like and where it's located at, the closest cancer center from Flagstaff, if you go in any direction from Tuba City, round trip is 150 miles. Where I'm from in Kayenta, that's 300-mile round trip. If you live in Chinle, that's 362 miles just to get to Flagstaff. If you live in Red Mesa, that's over 410 miles round trip. And so some of the things that can be addressed to address this issue is to increase rideshare services, but most importantly, expand cancer care support services. And so when we break it down, when we think about cancer patients by the numbers, and this data at this time point was taken in 2019, just to show what it was before we had a specialty clinic open up on the tribe. And so in 2019, Arizona had a population of Native Americans of over 362,000. At that point, there was no cancer treatment centers. And so I mentioned the distance that people have to travel just to get care. When you think about oncologists at that standpoint, the city of Flagstaff had one oncologist per 15,000 people. Phoenix had one oncologist per 12,000 people. Tucson had one oncologist per 7,000 people. The Navajo Nation had zero oncologists per 173,000 people. And so that has a huge impact, especially trying to get patients into cancer care that they need. So since then, Tuba City has opened up their care clinic there in Tuba City. And so they were the only cancer treatment facility on the Navajo Nation. And so they do provide diagnostic treatment and survivorship services. And so are able to do chemotherapy and infusions for a lot of different types of cancer. And currently there was no radiation therapy at the time. And I'm also happy to mention that also the San Carlos Apache Healthcare Center has also since opened up their own specialty clinic there in San Carlos. And so, again, addressing the gaps of lack of clinical trials, the Cancer Center, we have an Arizona Clinical Trials Network. And again, the goal is to provide clinical trial access to underserved and underrepresented populations throughout the state of Arizona. And so currently, right now, we're working with Yuma Regional Medical Center with our clinical trials, opening up a site there, as well as Kingman. We do have our eyes on working with Tuba City, with Northern Arizona Healthcare and Flagstaff, Southwest Cancer Care in Sierra Vista, thinking about what that would look like for San Carlos, and also one on the south, or I'm sorry, on the far east region of the state of Arizona. So again, just to make sure that a lot of our rural populations have access to clinical trials. And so another thing that we do, as I mentioned before, we do a mobile screening outreach where we offer breast cancer screening services through mammographies, especially working with the tribe. With these events, we like to do education presentations about breast cancer and then having them have the opportunity to get a mammography while they're learning about breast cancer. And we work with several different organizations to make sure that we get cancer screening available. And we have screened over 82 patients on the tribe itself. Moving on, when we think about another barrier is cultural considerations. A lot of the Western models of care can conflict with Native values and practices. There is a lot of consideration, especially when it comes to biospecimen collection, what the significance of a biopsy is, disposing of tissue, blood, and hair samples, even the topic of talking about end of life and palliative care services. That is a taboo subject, but it still needs to be thought about in a culturally respectful manner. In most cases, there's also the failure to acknowledge spiritual beliefs. And then another thing is there's a lot of clinics that the doctors, the nurses, the staff, they experience compassion fatigue, burnout. In some cases, clinics experience high turnover rates, which can lead to moral distress from healthcare providers on their end. So what are some of the possible solutions that we can consider is just promoting research on risk factors, causes, screening, early detection and treatment, conducting an environmental scan of resources on care and culture, explore resources for cultural support, incorporating traditional healing practices with mainstream treatment plans, and also increasing cultural competency training for our healthcare providers who work in these clinics. And so one of the examples that we have been working on with our Cancer Moonshot initiative here at the Cancer Center, we've had a study where we were working on disseminating colorectal cancer screening program practices in the southern plains and the Southwest United States. And so this was in collaboration with the University of Oklahoma as well as the University of New Mexico, where we trained and worked with patient navigators. And so the role of our navigators in this program they are amazing and they did a lot of work. And I cannot sing their praises enough. And so they were responsible for doing a lot of education and outreach, sending patient reminders, learning more about barrier assessments, doing interpretations, especially hiring the importance of hiring navigators from the community so they know the community themselves. And so it's not awkward for just transplanting someone new into a community that they don't know about. They also worked with transportation, getting people to and from the clinic. They also worked with fit kit delivery and pickup. They provided social support. They help patients linking from patients to their tribal health facilities to other facilities where they can get a colonoscopy done and a lot of appointment scheduling. And so, as I mentioned, yeah, and so they've done a lot. And so they did a lot of targeted approaching when they were targeting patients in the clinic setting. And so this is the impact of their navigation. And so our navigators had contacted over 1,200 people. And out of those 1,200 people that they connected with, They distributed over almost 1,000 fit kits that were distributed. Out of the 1,000 fit kits that they distributed, 52% of them were developed. Out of those 52% that were developed, 15% were fit positive. And so if you have a fit positive fit kit, they recommend a colonoscopy as a follow-up. And out of those 15% that came back positive, 60% got a colonoscopy. With the less than 100 people that they approached, which is about 7%, they said, no, I don't want the fit kit. I want a colonoscopy. And so with that, they were able to schedule their colonoscopy. And out of that, 70% of the people completed their colonoscopy, which is huge. And so when you think about it at a national level, the current national roundtable for colorectal cancer screening is at a target at 80%. Nationally, we're at 72% overall. But when you think about rural healthcare clinics, most of them are at about a 40% of what it looks like to get colorectal cancer screening rates. And when you compare that to our historical screening rates at IHS clinics, which is below 30. And so the sites that we were working at, we've seen colorectal cancer screening rates increase almost up to 155%. And this was during the COVID-19 pandemic. And so they did a lot of work. And so on our end, we were able to do a lot of outreach with them, providing support that they needed. Anything time they needed reminder cards, we were helping them with that. We have a big giant colon that we would take out to the communities, again, to assist with education and outreach. And so our program was so huge that we actually had a visit from former First Lady Dr. Jill Biden to come out and learn more about our programming. And so moving on, again, thinking about how can we integrate traditional medicine and therapies with our Western cancer treatments. We do have our Circle of Holistic Care program, and the goal of it is to improve health outcomes, to build resiliency for survivors, and encourage patient well-being. And so our initial work is to do a survey to figure out what our survivors need and want. And so some of the things that a lot of the that we got back from our survey, the interest of therapies that people are interested in is exercise and physical activity, diet and nutrition, a massage therapy, stress reduction techniques, and meditation. But we also asked what are their concerns for barriers to participating in some of these activities. And so number one being financial. There's other reasons. There was various responses. Another was lack of understanding of the risk and benefits of alternative medicine. Some people felt they had too many appointments, and then others felt like they weren't getting supported by their medical team and thought that this might not be of best interest to them. But we are still moving forward, and currently we do offer meditation, Tai Chi, and yoga to our patients who do come to our cancer center as a model, as a alternative. And these are some things that we also have to consider when we think about treatment plans, about ceremonial and spiritual healing interventions. And again, our people are resilient. We have been here since time immemorial. And so there are a lot of interventions that we can consider, especially thinking about spiritual healers being a healthcare provider, and incorporating traditional healings for overall health and being. And there's also several different types of ceremonies that we can consider, especially when we incorporate this into a cancer care treatment plan. And so this is also bringing a huge turning back to what it looks like when we come to Native American healthcare. Because when we stand back and look at it, we think about all the diseases that we are currently facing, like diabetes, mental illness, trauma, and suicide in our tribal populations. And a lot of the Western healing interventions may not be as we haven't seen their decrease in some of these health interventions that we've seen. So this is a call to possibly returning back to indigenous healing, our wellness philosophies, our health teachings and interventions to empower our communities to heal themselves, especially what that would look like in the cancer setting. And so again, using our wisdom to promote health and knowledge, because our wisdom has sustained us for many generations. And again, these practices are protective and must be explored to further enhance physical health, psychological, social, and environmental health. And so I really do like this screenshot from Reservation Dogs because again, thinking about prayer and how that really helps, especially when it comes to an overall mental health being and how that can bring some type of harmony and balance, especially for our cancer patients that are facing their cancer journeys. And so, with that, I will stop here. And I'd like to thank you for your attention. And here's my contact information. And I felt like I went through a lot really quickly, so I am happy to answer any questions that you may have.
Yeah, I have Dr. Yellowhair. Thank you very much for your amazing presentation. See if there's any questions in the chat.
Our first question is, why is the CRC screening intervention called the Moonshot Initiative?
Yeah, so the Moonshine Initiative was enacted through the Biden administration, where they had a huge push to fund programming across the US. So several different universities and um, cancer centers applied for a grant. And so it's just the name of the grant, the Moonshot Initiative.
People are saying great presentation, lots of data, but they love the way you displayed the information. And others would like to know if the slides of the presentation will be shared. I imagine the grant associated with the Moonshot is no longer funded. Any ideas on how to continue this program?
Yes, and so our funding for that program has since ended, but we were working with all of our clinics that the clinics that we were working with to find ways for them to help make the programming sustainable. And so one of the healthcare facilities that we were working with kept the navigator on and continued her position there and focused on colorectal cancer. And so they were looking at hiring another navigator to also have a focus on breast cancer. And so even though the grant has ended, we are still in contact with our partners and seeing how we can still provide support and any outreach needs that they have. So yeah, so a lot of great work in those communities that they were in.
What can tribal members do to support institutions treating cancer patients?
That is a good question. So there was a lot of barriers in some of the work that we're doing. And so I think a lot of it can come back down to awareness and education. So that way, working with people who are at age to get screened. So I think a huge key is prevention and early detection. We cannot stress that enough. Screening and early detection does save lives. And so if you can catch a cancer in the early stages, you can get it treated. And so that also increases your chances of survivorship. The other thing, another key thing is I know cancer is a taboo topic in a lot of tribal communities, but it's something that we need to address because if at our cancer conferences, we always ask a question of like, how many of you know a cancer patient or a cancer survivor? And almost everybody's hand comes up, but no one is really talking about it. And so I think it's a time to start addressing this and bringing that awareness and education so that way, people should know when they should get screened for cancer.
Have you been taking your Let's Talk About Cancer to the reservations, and did you have similar results with early screening? And also, do you deal with generational differences with the cancer topic?
Yes, and so those are a lot of good questions. And so we do have our Let's Talk About Cancer at the Pascua Yaqui tribe, and so we're open to travel around the state. With this initiative. So that is in partnership with the Pascua tribe, and that's where we do see an uptick in uh, cancer screening and intent to screen. And so again, that also comes to the wonderful work that our navigator is doing there as well. And so one of the main goals that we want to do is to expand that navigation services to other tribal communities. And then to the other half of the question about generational um, approaches about the conversation. And so a lot of the survivors that we do talk and that we do highlight in our events, some of them are childhood cancer survivors and some of them are adult survivors. And so you do get different perspectives. And but a lot of the older survivors are the ones that are the biggest advocates in the room to remind people to not ignore any symptoms that you may have. And the younger cancer survivors, they talk about how, you can survive cancer because now I had it as a child, but now here I'm an adult. I'm here and I'm surviving and I'm thriving and I'm sharing my story. And so, and again, don't ignore your symptoms. And so they sometimes share what their first initial symptoms were. And so, hearing their stories are amazing. So that's always my favorite part of that conference.
There are quite a few other questions in the comment section. Have you thought of applying for the Rural Health Transformation Program for initiatives that you currently don't have funding for? And then wanting to know what is the estimated wait times for appointments for colonoscopies in the rural areas? And I'll let you answer those two, and then I'll come back.
Yes, so we are actively looking at the rural health transformation program across the university and seeing how we can, especially in a lot of our tribal communities, address some of these issues. And so there's a lot of different avenues. And so, yes, we are planning on actively working to apply for those initiatives, especially working with our tribal health facilities. As far as the wait time for appointments, I cannot say definitively because I'm not working in those tribal clinics, especially in the rural areas. It also depends on the infrastructure in some of the 638 facilities of whether or not if they have the capacity to do their own colonoscopies. I believe some are slowly coming on board and being able to handle colonoscopies. Um, but again, it's also working with the patient navigators to see when they can get appointments set up. Um, so that's a little tricky, more trickier question to answer, and it just depends on where you're at. How can tribal healthcare clinics incorporate cultural wisdom into cancer
Yes.
care? So I think a lot of that has to come with training. And so I think what would probably be most beneficial is if we have our clinicians who have previously worked in tribal clinics share their experiences with people who are going to start working in tribal facilities. I think that's a good learning lesson so they can share best practices. But not only that, I think a lot of that can go back to medical school when people are actually getting trained in their medical training and thinking about getting that background and what it is to be working in a tribal community. And so I think that goes a long way. And I also think just a lot of education that needs to happen on both sides. I think just being open to share that with maybe it's part of the orientation when you get new clinicians at the clinic to kind of give them okay, welcome to our clinic, welcome to our community. Here are some best practices and things that you should consider and avoid.
And what is the future state? Have you been able to invite people into clinical trials?
And so that is what we're currently working on right now is to expand access. And so we are getting people into our clinical trials currently right now in our Kingman and as well as our Yuma clinics. But when we think about clinical trials, it's a huge breadth. So we can think about prevention trials all the way up to where you think about chemotherapy trials. And so it just all depends on the infrastructure of the location. As you can imagine, not all locations have infrastructure for infusion clinics, but they might be open to having a prevention trial. So, for example, in San Carlos, they're having a intervention for cancer patients who are about to go into surgery, where the intervention is okay, let's work on your physical activity, let's work on your diet. So that way, we're hoping that will improve your outcomes after you have your surgery. And so, see, that is another example of a clinical trial that's more of a prevention trial. And so it's not all what people think when we talk about clinical trials. So it just all depends on what the site is open to do and able to do.
Are there any collaborations with Mayo Clinic Cancer Center?
Well, we're all here today working together, and unfortunately, there's enough cancer to go around. So yes, we like to work and collaborate with our cancer centers all across the U.S. We currently have a National Institute of Health colorectal cohort. So a lot of the comprehensive cancer centers across the U.S. are currently meeting and sharing best practices. And so we do share the work that we're currently doing. We talk about the barriers. Well, I think we are kind of past talking about barriers because we know what they are. We're more or less focusing on concrete strategies and how to address these barriers. And so with these monthly meetings, we're able to share best practices um, and what works and what doesn't work. And so that's very important. And then also forming partnerships. So just like the Moonshot, where we worked with Oklahoma as well as New Mexico. So we're very much open to partnerships. So yeah.
Do you know of any plans for another cancer center on the Navajo Nation?
That I haven't heard anything about, so I can't answer that. I am not too sure.
And how are you able to gather data? Your data is very current compared to our state, Montana.
So the data that I showed in this presentation is from our Arizona Department of Health Services. They have a great team there. I think Geraldine is on the call. I think I saw her name. They have a great data dashboard that we use but that provides statewide data. And so unfortunately, though, when you're looking at tribal specific data, that's more challenging because not all tribes report what their data is. I know the Navajo Nation also does a great job. They have a epidemiology program and a dashboard that also reports their cases on what they're seeing in cancer in on the Navajo Nation. And so that's the big thing is just how do we get more accurate data and to show how cancer is affecting our tribal communities.
How could you bring more attention to younger women with dense breast tissue? More education is needed for sure.
Yes. And so I think a lot of that, again, is working with our navigators, our health workers to increase presentations and awareness. And so sometimes there's really good videos that can kind of show that information, especially when it comes to anatomy and physiology. And so one of the nice things that we do with our Beyond Cancer as well as our Let's Talk About Cancer is that even though they're lunch and learns or they're a conference, we actually invite oncologists, patient navigators, as well as survivors to these events. And so we keep it very informal. So not patients, I'm sorry, community members, anybody can ask these type of questions. And so the rooms that sometimes that we are in, they have dry erase boards. And so sometimes it becomes a lecture, which is fun.
And our last question says historically, Native Americans and indigenous communities are underrepresented in cancer genomic initiatives. What are your thoughts on how we can improve cancer disparities in this space for and with the community?
That is a great question. And that is actually probably the $1 million question that I always get asked from a lot of people. And so again, I think it involves working in partnership with tribal communities, especially I think if we can bring in our leadership, our health organizations that work in these communities, partnership goes a long way because our healthcare providers in our tribal communities are our trusted people. If we can bring them in and learn from each other, I think that can also help bring more representation, just bringing awareness and knowledge. And I know there's a lot of historical trauma in the past when we think about medical research. Just finding ways and how we can proactively work together in communication and education, I think that goes a long way. And then most importantly, I think what's important is for the report back. I mean, if people are going to participate in some of these studies, I think it's important for the organizations to report that information back to the communities and making sure that it's beneficial for the communities to begin with. So that's my short, long answer.
Um, The last comment says, my mom and I, she has cancer, were surprised that there aren't cancer support groups for Native people. We went to several different orgs, but there weren't any they knew of specifically for Native people.
Yes. And so that is something that I am working with my office. And so That is what I've also heard from several different of our tribal health organizations here in Southern Arizona. And so this is one of my big things that I want to focus on is creating a statewide tribal support group for our tribal communities, our survivors. Some of those steps it's going to be a little bit slow, but it's going to make sure that we have a comprehensive survey that we will help distribute through our health organizations to distribute to our tribal cancer patients to see what it means to have a tribal specific support group and making sure that their needs are getting met. I would love to have our healers participate and potentially run some of these groups. Again, making sure that the survivor support group is culturally grounded and that it's accessible to everybody across the state. I'm trying to figure out the format, if it's hybrid, in person. We do want to tie this into our Beyond Cancer series because we are getting a lot of requests for our Beyond Cancer conferences. And so I think if something is known, I think we could follow under that. So, but yes,
Thank you. No additional questions at this time. People just are expressing their enjoyment with your presentation.
thank you.
What an amazing presentation. Thank you so much. One of the things that I wanted to ask real quickly is you mentioned that you're working with tribal communities, you don't have access to the data. So my first initial thought that popped up was respect to data sovereignty.
Mhm.
So can you elaborate a little bit more on that over working with tribes?
Yes, and so we are coming from the standpoint that this is the tribe's data, and so we're respecting their sovereignty, and so the tribe will have access to it, and so they are going to be the ones to say who can or cannot have access to it. And so from our standpoint as the Cancer Center, we only have a very few limited people that will have access to the data. And again, it's more of a technical support capacity because the tribe themselves, they have their own epidemiology department. And so it's just figuring out how we can best work with them. Again, providing any support that they need. And so we're leaning on the tribe to guide us on what they want to do. And so rather than historically where organizations tell them, oh, you should do this, or I don't know, we're letting the tribe let them guide us. And so we're learning from them and having true respect for working with this partnership and making sure that it's sustainable. We would like to expand this to other tribal communities that are interested. But again, we are letting the tribes lead this because it's the information that's being collected from their own members. And so it's best that they lead on what they want to do with it.
Thank you very much for explaining that very in depth. So with that, with no further questions, we want to thank Dr. Monica Yellowhair for an amazing um, presentation. So just to be mindful is that those of you that are interested in revisiting and listening to the session again, it will be uploaded to YouTube. So with that said, please take a moment to click on the link or scan the QR code to complete a short survey with your feedback. And there were some very great questions that were shared. And also just wanted to give a shout out over to the amazing work that University of Arizona is doing under Dr. Yellowhair's leadership. So with that said, please stay tuned for our next Indigenous Health topic, which will be on August 21st, 2026. And just a reminder is that Indigenous Health topic is held every third Friday of each month. And this is a virtual session. So please share with your community. And if you're unable to make it, you can always view the past Indigenous Health topics YouTube. So with that, from the Mayo Clinic and over from the Cancer Center, we say thank you very much. Ahiaha to each and every one of you for joining us, and you have a safe weekend. And for those of you that are having kids going back to school, be safe as well out there. Ahiaha la. Thank you.
Thank you.